Hello, good day. I am John Paul Mumar from Section 3E. So today I will be demonstrating the basic life support for an adult patient with cardiac arrest. So the first thing we will do is to check for the responsiveness of the patient. We will do this by tapping the shoulder and asking the patient if he or she is okay. So like this. Hey, hey, are you okay? Hey, hey, are you okay? So if there's no response, we will have to call for help. So if there are bystanders around, we instruct them to call for help. And in our case in Cebu City, we can call the air roof, which is 161. That's their hotline. If there is nobody else around, the responder will have to do it him or herself. So the next thing to do is to check the pulse and breathing of the patient. So we can do this by looking, listening, and feeling. So we can do this by putting our ear on the chest of the patient. So we will be listening for the heartbeat. And at the same time, looking at the abdomen of the patient to check if it's rising or falling. So we can see if the patient is breathing or not. So if patient is not breathing and no pulse, we will proceed with CPR. So first, we locate the sternum. So it should be between the nipple line and on the uh, we should look palpate for the hard part, and on the lower half of the sternum we'll use our left hand as our base, the heel of the left palm, and with our right hand we will interlace on top of the left hand and place it on the lower half of the sternum. So before compression, we must put into mind that the compression rate should be 30 compressions is to 2 ventilations. And the rate should be at a minimum of 100 per minute. And the compression depth should be at least 2 inches or 5 to 6 centimeters deep. And once we do a compression, we should allow for the full chest recoil before giving the next compression. So, like this, on the lower half of the sternum. So it should be, again, 30 compressions, 2 breaths, at a rate of 100, at least 100 per minute. So in this case, I've done the counting in my mind, but usually we could do the counting also while we do the compressions. So once 30 compressions are done, we will be giving the 2 ventilations or breaths. So in order to do that, we will do the head tilt and chin lift. So this is done in order to avoid the tongue being in the way of the airway when we do the breaths. So head tilt, we place our hand, all right, in this case, in my case, my right hand on the forehead, and at the same time, we do the chin lift, like that. So the angle of the patient's head should be like this. And then, before giving the ventilation, we should ensure that the nose is pinched and the mouth is open. So we give 2 breaths. So while we give the two breaths, we should ensure that with each breath, the chest rises. So that means there is air going into the lungs. And one breath is around 1 second, and we should resume the chest compression in less than 2 seconds. So again, 30 is to 2. 30 chest compressions, 2 breaths. And then resume in less than 2 seconds. So if there is another rescuer present, we could ask for assistance because doing the uh, CPR cycles is physically exhausting, as you all know. So we should do the rotation approximately every 2 minutes, or it depends on the capacity of each rescuer. So we will then stop the CPR if the patient, there are categories to stopping the CPR. So if the patient is obviously dead, such as if we notice the rigor mortis, if it has already set in, or if the medical professionals that we have called earlier have arrived, then they should take over. Or if or if there are many rescuers are already physically exhausted, then we should stop the CPR. Or the, if the only good outcome happens, that's when the patient starts breathing on his or her own, and if we can see that she's stable more or less, like the breathing pattern is okay, and we can check for the pulse. So if patient's breath and pulse are back, then what we'll do is uh, we should allow the patient to be in the recovery position. So that is with the patient lying on his or her side with the uh, with the hips flex and the knees flex also. So like this, and the hands on the side. So that's it for the BLS demonstration. I hope I demonstrated it well. Thank you for your patience in watching my video.